First of all, we high dust, then low dust, making sure that we not place our hands in corners or other areas that we can't see behind, because there may be a contaminated needle or other sharp object accidentally left behind. Next, we strip the bed and placing the soil linens in a laundry bag, which is later taken to the laundry room. Now, during the sanitizing and cleaning procedure, heavy gloves are always worn as a protection against cleaning agents and protection from contaminated blood or other unknown fluids. Then the trash bags are removed from the containers. Now, when we carry these bags, it's real important that we hold the trash bag away from our body in case there might be a sharp object inside. Then the floor is dusted, then sanitized, and the bathroom is also thoroughly sanitized. And the last step is to inspect the room to ensure that everything is cleaned and sanitized and ready for the next patient. The universal precautions are important to the housekeeping staff because we come in contact with all different contaminated fluids. We clean spills and we handle soil linens. So we wear gloves and we follow the recommended procedures to ensure our own health and safety. The sharps containers are removed from the rooms between patients. But before we remove them from the wall, the cap at the top is securely locked. Then a key is used to remove the container from the wall. Then we take the biohazard label from the bottom, peel it off, and place it across the top of the container. Then it's taken to the soil utility room and placed in the proper container to be disposed of.
Our infectious waste, or medical waste, if you will, is put in a red liner, which is of 3 mil thickness, placed inside of a cardboard box that is located in a dock area that is labeled infectious waste as well. It's sealed, and at that time a vendor comes in, picks up the cardboard container and take it and have it incinerated. Some of the safety precautions we have in place here. We instruct our people when putting the bag into the box that they do not push down on the bag with their hands. Also, that they do not carry the bag close to their body. When folding the liner into the bag, we make sure that it is properly closed where no airborne germs can be placed out. Also, we have them in proper protective clothing and the regular general hygiene type things. Wash your hands prior to eating, and anytime you're leaving the area, wear your gloves, etc.
In the dental office, even with our young patients, we still have to take the same universal precautions to protect ourselves, our staff, and other patients from bloodborne pathogens such as hepatitis B and HIV. There are several things we do to protect ourselves. We wear masks and eye protection to keep particles from getting into our eyes, nose, and mouth. We have to, as much as possible, use some type of barrier technique, such as the rubber dam we are using with this patient, which cuts down on the amount of saliva that comes out of her mouth. We even use high-volume suction and try to evacuate saliva as much as possible and to decrease the number of airborne particles. Between patients, we must disinfect and sterilize everything we use. Many items are used once and then thrown away. Items not easily disinfected or discarded, such as switches, are covered with a throwaway film. The hepatitis B virus and the HIV virus may be present in saliva mixed with blood. Because we have our hands in the patient's mouth, it's very easy to get infected. The gums usually bleed, so if you have a micro crack or cut in your hands, the potential for infection is present. Wearing gloves is very important. We don't wash or reuse the gloves. They are thrown away after each patient. And if we leave the work area for a moment, we must rewash our hands and put on fresh gloves. We wash our hands thoroughly between patients, cleaning any debris from under the nails. And we must treat every patient as if they're infected with the hepatitis B or HIV virus, whether it's true or not. The history may not show it, and the patient may not know. Therefore, we must take the same precautions as if the patient is infected with the HIV virus or the hepatitis B.
The new OSHA regulations are the law because it is so important to protect your health and safety on the job. You must observe the important universal precautions. So from this moment on, day in and day out, treat all blood and other potentially infectious material as if they were infectious. Taking universal precautions must become a routine part of your job. Get the hepatitis B vaccination. The vaccine is safe, effective, and available at no cost. Get the vaccination. Always protect yourself with appropriate barriers, such as gloves, masks, and goggles. Do not wash or reuse disposable gloves. Handle sharp instruments carefully. Do not recap, remove, or bend needles, unless it's required by a medical procedure. If recapping or removal is required, you must use a mechanical device or a one-handed technique. Put all regulated waste into color-coded bags or containers with biomedical warning labels, and handle the bags or containers carefully. Clean up blood and fluid spills as soon as possible. Disinfect carefully and safely using gloves and an appropriate disinfectant. Remember that all of the protective measures we've talked about are required under the law. Comprehensive training on bloodborne pathogens and the requirements of the standard are also required, and records of this training must be kept. Every few minutes, an innocent new life begins, precious, sweet, and vulnerable. But if that child's blood is infected, then you are vulnerable. You must treat all blood or other potentially infectious materials as if it were infectious. Make universal precautions a routine part of your job. In his novel about the plague, Albert Camus used a healthcare worker as the storyteller. So have we. And you have seen other parallels too. Caring for patients, human compassion, professional responsibility. Everybody knows that pestilences have a way of recurring in the world. Yet somehow we find it hard to believe in ones that crash down on our heads from a blue sky. The thing was to do your job as it should be done.